Hello, I'm Dr. Maurie Markman from City of Hope, and I want to briefly present really a fascinating effort, one that needs to be applauded and applauded again, and then to sort of scratch our collective heads and say, why do we do it and what do we learn? So, what I'm referring to is a report recently published in the Annals of Internal Medicine entitled Long-Term Effect of Randomization to Calcium and Vitamin D Supplementation on Health in Older Women. Post-Intervention Follow-up of a Randomized Clinical Trial. The title of this report does not do it justice. This was a massive, one could, I believe, even use the term, Herculean effort. Ask an important question that was asked more than 20 years ago. So this was a women's health initiative, national initiative to answer these questions. The study looked at 36,282 postmenopausal women who at the time of agreeing to be randomized to this trial had no history of breast or colorectal cancer. This was a 7-year randomized intervention effort. 40 centers across the United States participated, obviously funded by the government. Randomization was 1-to-1, placebo or 1,000 milligrams of calcium and 400 international units of vitamin D3 daily. They looked at the incidence of colorectal cancer, breast cancer, and total cancer. And importantly, as an endpoint, total cardiovascular disease and hip fractures. They didn't comment on hip fractures in this particular analysis. Obviously, the hip fractures relates to this, obviously, this question of osteoporosis in the postmenopausal women. So here's the bottom line. With a median follow-up now of 22.3 years, that's not 2 years, that's 22.3 years, there was a 7% decrease in cancer mortality in the population that received the calcium and the vitamin D3. Nothing to snicker at, nothing to say, wow, that's not important. However, in this analysis, involving obviously several tens of thousands of women, there was a 6% increase in cardiovascular disease mortality noted and reported. And overall, there was no effect on all-cause mortality of this intervention with a hazard ratio, you rarely see this, of 1.00. Much that can be said. I will summarize my comments very briefly. Obviously, criticize this if you want, not inappropriate criticism, but what was the individual impact of the calcium versus vitamin D if they had only used one versus the other, or used both, but in separate arms of the trial, and you could have separated out what might have been caused the decrease in cancer mortality and not the increased cardiovascular disease. This was designed more than 20 years ago. That's one point. Second is, how many more tens of thousands of patients would they have had to do this, and at what cost? So this massive study, national study, simple study in that sense, in terms of the innovation, low risk, if you look at the long-term outcome, at quite a cost. You can only imagine how much it would have cost to do that study today in terms of not the cost of the calcium, the vitamin D3, but in fact, the cost of doing the trial concluded no impact. So from a societal perspective, it was an important question to answer, certainly then. What do we learn and at what cost? Bottom line is we have to figure out a way of answering these kinds of questions, and perhaps now they should be from real-world data, looking at electronic medical records, looking at a variety of other population-based data. We can get the answer not in 20 years, but in perhaps 2 months, because we've looked at the data, perhaps using artificial intelligence to help us to answer these questions, and maybe not 36,000 patients, but 360,000 individuals looked at over this period of time. Again, I'm proposing an alternative solution because the questions that were asked 20 years ago remain important today. But this cannot be the way we in the future try to answer them, certainly from the perspective of cost and also the perspective of time to get the answers. So I thank you for your attention. Again, let me conclude by, again, applauding these researchers, both because of the quality of the work they started out doing and they ended up doing and reporting. But I think we've learned that we have to come up with alternative ways to answer what were important questions then and are important questions today. And I thank you for your attention.